It may sound unusual, but a feeding tube is behind a new FDA-approved weight loss procedure called AspireAssist. Now, this procedure helps people who are moderately to severely obese, that is, and it removes about 30% of the food from their stomach before the calories are absorbed. So how does this work? Well, here to tell us more about it is bariatric surgeon Vafa Shayani and weight loss patient Amber James. Thank you so much to both of you for coming in this morning. Okay, doctor, let's start with you. So how does this work?
I think most of us are very familiar with feeding tubes being used for feeding patients. This technology allows us to use a feeding tube to empty the stomach.
Okay.
So imagine patients consuming normal amounts of food that they're used to, but that amount of food does not allow them to lose weight. By giving the opportunity to the patients to empty their stomach through a small button that is on the outside, you kind of contribute to caloric reduction. So imagine a patient eating about 2,000 calories in a day. By allowing a third to half of that coming out, now their body sees actually somewhere around 1,200 to 1,500 calories, and that allows them to lose weight.
Okay, so you put a feeding tube, and we have this animation, this graphic here. We talked about this before. So this is really unusual, and I have to admit, there is a bit of an ick factor to go with this. So why this particular technique?
You know, you're not the first person who's asked that, and in fact, in our own home, my 20-year-old daughter, who's a psychology student, has brought that up, and we've talked about it. At some point, our patient Amber will talk about that as well. When we talk about the epidemic of obesity and the great lengths that patients go through to combat that, this is another option for patients that give them the control over what they can do to help themselves with reducing calories and weight loss. And most of the patients who do this actually love the fact that they have the control. And perhaps the most unique thing about this procedure is it takes away the element of deprivation. Just about everything we do with our patients for weight loss comes with an element of deprivation, and patients who utilize the AspireAssist device tell us that that element to some extent is eliminated. They're able to enjoy the food the way they have always eaten. They do become cognizant of how much waste there might be, and little by little they improve their eating habits, but all of that without feeling deprived. And I would love to hear what...
Well, I was going to say, well, Amber, let's talk about your experience. So you started this how long ago?
3 years ago.
3 years ago, and you've lost?
70 pounds.
70 pounds. And tell us what you think about this method.
Oh, I love this method. It did help me learn how to eat better and make better choices. And sometimes because you have to chew and chew and chew to get the portion small enough to make it easy to aspirate, some people will learn how to eat less automatically, because to aspirate you have to chew and plus drink water.
Okay, wow. Do we have the before and after picture? Did we put that up already? Let's put that up again, because this is a big difference. And tell me how this has affected you and changed your life.
Well, I'm more confident now because of it. I exercise more, and I learned how to eat different. I make better food choices. I started eating more vegetables, and it kind of helped me understand like why certain foods like donuts, cookies, or muffins was bad choices, and why I felt not satisfied with eating them versus if I eat like apples or pineapples or oranges.
Okay, obviously then this is something you would recommend. So doctor, who is this particular procedure for, and who should not be doing it?
Any patient who has a body mass index of 30 to 40, that's commonly somewhere between 50 and 100 pounds overweight, would benefit from an entirely non-surgical procedure. This is done without use for general anesthesia, without making any cuts in the abdomen, entirely reversible, and it also preserves the natural anatomy. There's no cutting, there's no elimination of any portion of the stomach, there's no rerouting of the intestinal tract.
Okay.
So many patients would welcome having the opportunity to lose weight with a totally reversible non-surgical option that then can be possibly transitioned to something else if needed.
So that's probably why you're going to say it's better than like a bariatric surgery or the other types of surgeries.
I wouldn't necessarily use the word better. It's
Different.
Another option, and
Okay.
it's different, and
Okay.
many patients welcome it because they feel like they're in control.
And I think it's interesting that both of you said you learn how to eat differently, because for me, I would think, how does this teach you how to eat differently? Because, you know, you're still able to eat whatever you want, so I don't understand that part.
Well, I think a lot of my patients have told me when they see how much waste there is when they empty their stomach, it has had an impact on how much food they consume
Which is what you
sitting.
said. Yeah.
Yes.
Yeah. So, and this is 1 year now FDA approved.
1 year FDA approved, but has been around internationally for about 3 years.
Okay. Very, very interesting. And if people want more information, what should they do?
They can go on AspireBariatrics.com, or in these days online, there's lots of good information from patients like Amber and other people who've had the experience with the procedure.
One last question. Are you still, do you still have it?
Oh, yes. I'm in maintenance mode.
Okay, so
with
how
it.
long will she keep it?
This can be a permanent device. There's no reason to think of it as temporary.
Wow.
So
Okay.
for patients who struggle with this for life, this is ideal.
Very interesting. Thanks for coming in and sharing your experience, Amber. We appreciate it. And thanks for sharing this new technique with us.
Pleasure to be
so
here.
as you said, another option. Okay, let's go over.